Good morning. This is Carol Dixon. I'm with Idaho Federation of Families for Children's Mental Health. We want to welcome you to our November webinar. If you joined us for October, it was exactly a week ago, so we've kind of got them sandwiched in a short, period of time. But I wanted to let you know that we're really excited to have with us a panel of parents that are from the Parent Network. And I'm going to let them explain to you exactly what that is. One of the things that I'm most impressed with this group of parents is that they have only existed for 1 year. And the amount of work that they have accomplished in that short period of time is really significant and has made a difference for our families across the state as a new system of care is being developed for children's mental health. So welcome, and with that, I'm going to let them introduce themselves and tell them just a little bit of whatever you want to say to let folks know who you are.
Okay, my name's Vanessa Morgan. I have 3 kids. One has mental health needs, one has autism, and the third we think doesn't have any particular diagnoses yet. I've been involved with the YES project for a few years now. I serve on the interagency governance team that oversees the project. So, go ahead.
I'm Jen Griffis. I have 7 kids. In that crew, we have several different mental health and developmental diagnoses. I serve on a couple of work groups with the YES project, including due process and workforce development, and then also work on the governance team as well.
And I'm Janet Heckey. I have 3 children. My youngest has Angelman syndrome. My middle son is neurotypical, and my oldest son passed away due to suicide almost 7 years ago now. I've been part of the Parent Network for a year and worked on several committees with the YES project for almost 2 years now, including workforce development and the services and support subcommittee and a few other committees. So.
Okay, thank you very much for joining us. And when they talk about their different work groups that they're involved with in the YES project, which is the Youth Empowerment Services, which is the new system of care for children's mental health, and they'll go into that a little bit more. Recognize these are all volunteers. These parents have given their time because they are passionate about seeing an improved system and because they recognize that parent voice is unique and being able to shape the system into something that truly is strength-based and family-friendly. So I'm just going to kind of throw questions out there, and you guys can answer as you feel like whoever can best address it. So the first one is, what is the Parent Network, and why does it exist? Does anybody want to take that one on?
So I've got it. So the Parent Network is a network of parents from across the state. I think that's probably the component that is so unique and important about this group. We really seek to make sure that there's representation from every region, and eventually we would love to have representation from just all of the communities within those regions. But it's a network of parents from across the state who have a child with an emotional or a behavioral health challenge. It exists for a couple of reasons. It exists really to connect parents to each other. That was one of the things as we were kind of working with the YES project. There were requests for parent stories and for parent experiences and just that parent voice. It was a challenge to kind of find those voices. There wasn't just this great connection. There were pockets, but nothing that was truly kind of a statewide network. So it exists to connect parents. It also exists to provide parents with information about the YES project, and then to provide the YES project with information from parents. So those are, it's kind of has an opportunity to really just be a flow of information back and forth as the project comes into existence.
Okay. So, and you're talking about parents being involved in it. What difference do you think it has made in having parent involvement as they are kind of developing and implementing this new system of care? What difference does it make to have parents there?
It makes a huge difference. It makes all the difference in the world. The people who work for the government agencies that are responsible to create this system of care are good people, and they have the best interest of children at heart, but most of them are not parents of children who will be using the new system of care, and they don't know what they don't know. And so having parents at the table makes a huge difference. There's been several times that I've made a comment about, okay, well, what about something? Or that's not actually how it works. And people are shocked and amazed and change the entire course of what they're working on because they didn't know how it really worked.
I would completely agree with what Vanessa just said. I think one of the biggest impacts that we as parents have on the system is talking to the decision makers and being able to express to them how it works in the real world and what our real world challenges are. It's very easy when you're working in a tower in a silo to think that the decisions that you're making, they make sense. They're logical and they follow this nice linear thing, and it's like, oh, well, we can make this work in this way because, this is already almost there, so we'll move that into place first because that's what makes linear logical sense, and we're able to bring stories to the table, real life experiences about how it works in the system and where we are right now, that has a real impact on them because it's very hard to listen to a parent express their real life story about their crisis and what has happened in their lives, and not have it pull at the heartstrings of the people there so that they understand in a very visceral way that what they're doing impacts our daily lives and makes a tremendous difference on the success not only of our children but of our family unit as a whole.
I would just add that I think another way that parent involvement has really impacted the project is through just creating a sense of importance about parent voice. The new system of care actually relies on parent voice within the treatment plan and that whole treatment planning process in a way that has not happened before in the children's mental health system. And so I think that the fact that parent voice is going to be so important at that level, really creating a desire for that voice to be incorporated at the higher levels of the governance and the development of the project, I think that's been pretty critical too.
Okay. So what has it been like coming into and some of these work groups are big, these committees are large, and to be like the parent, they are trying to represent a larger group of statewide parents and understanding what that individual experience is like. How have you pulled that off in terms of, I'm the parent, I've got something important to say, I'm valuable?
I was really nervous. The first work group meeting I walked into, the room was full, and I was a minute late because I didn't know where I was going. For the first hour or so, I didn't say much. I just observed and listened, and then I realized that I was the only person in the room who actually had lived experience with what we were talking about, and so I decided to speak up. And as I have continued to speak up, I've been amazed at the respect that I've been given and the appreciation. These are good people who are working on this project, and they want to hear from us. They want to know what they can do better and what it's really like. And so, yeah, they've been very grateful and very respectful of everything I've shared.
I completely agree again with Vanessa. For me, the first couple of meetings that I walked into, I was like them in regards. I didn't know what I didn't know. I didn't know what the project was really about or how or why my voice was asked to be there. I honestly didn't even believe that maybe my voice was representative of other parents at the table or that my experience was. So I wasn't really sure that I was even in the right place at the right time, or that my voice would have any impact on the system at all. I have been pleasantly surprised to find out how important not only my story, but the other families that I hear from, how important our stories are to the system and how valuable they are, and how much people really do want to hear. They want to know that all the effort that they're putting in and all the meetings that they're going to and all of the work that they're doing to try and redesign the system is going to have an impact, is going to be successful in the end. And they're using our feedback right now to determine whether or not it is having an impact, it is going to be important, it is going to do what they want it to do. Because it's a lot of effort on their part to change a system that, is a slug. It doesn't like to move quickly. And there's a lot of different moving parts, and to try and get those moving parts to mesh and everyone to talk to one another has been a monumental task, to get all the different parties involved, because there are a lot of different agencies that operate in their own silos, and we have them all sitting at the same table trying to create this new system of care. And I think it's been incredibly valuable for me to be able to sit at the table my own. I feel like I've gained more almost than the system has in a lot of regards, because it's helped me recognize that so much of what my family went through was because of a mental health disorder that my child had. And it wasn't my parenting. It wasn't that I was a horrible parent, that I just didn't follow the handbook closely enough to make sure that, I was following all the rules and checking all the boxes and everything, because that's the feedback that we get from our community and from a lot of times from our physicians too, is that, if we just parented this way a little differently or that way a little differently. And I think that's really important feedback for the system to get as a whole, that look, we're out there operating without a handbook, and we're way off the course of what raising a neurotypical child looks like. So it's been hugely beneficial for me just individually to feel like I've learned more about what I did raising my son in the last year than I did in the 18 years that I raised him. And the system is benefiting from that knowledge too, because I'm able to give them feedback about what it's like to be a parent in the system. And it's a little nerve-wracking at first, but in the end, it's incredibly empowering to have the decision makers really listening to what we have to say and watching the system change and move because of the feedback we give it.
And it seems like we're at a time where I think often parents have been really frustrated because they have been giving feedback and they want to see change, and it was like the door was kind of shut. So now the door has cracked, and the state is very much saying, we want parents participating, we want to hear what you have to say. And so going to Jen, I think she's really in a unique situation because she takes it all the way back to the very beginning. And this new system is being created because of a lawsuit that dates back to 1980, for which there was a mediation process that started 5 years ago.
Yeah.
And from that mediation process came the settlement agreement, and that settlement agreement is what laid the framework for what they are now building in the YES project. So Jen was the first parent to step her toe into really participating with the state. So what is it? What have you seen in that evolution of being the first parent at the table to now, being involved in this new system of care as they're developing it?
Yeah. So it is extremely interesting to walk into a room of professionals as a parent, and I have a very distinct memory of the first moment that I did that. I think there are definitely some challenges. One of the challenges that several parents deal with, even as they're working on the regional level, is the tension between working with a professional as an advocate for parents and that parent voice role, but then also having the same professional being the clinician that's staffing or working with you on your child's case. And so that's an interesting tension to try to manage sometimes. The other challenge that I think I've seen so often is recognizing the bureaucracy that's there within the system and separating that bureaucracy from the people that are working in the system. Like they've said, it's everyone working on this project has a heart for kids and for families. And they have the best intentions, and sometimes the limitations are beyond what they can manage. And so being able to recognize the importance of relationship in the midst of that, really working to develop relationship with the professionals that we're working with, that's been really key for me. The other piece is just curiosity. One of my goals is always to be curious about someone else's perspective in a meeting and why they're reacting the way that they are, why they're saying what they're saying, maybe why they're not understanding my perspective. And then the other side is just to try to help professionals develop a curiosity for parents and for our experiences and for our stories, because I think that's how we continue just to create more value for parent voice and parent experience. And I've seen that transition happen. In the first meetings that I was involved in, I really didn't share a lot about our story. I was very cautious, and I think there were reasons for that. Slowly that began to transition, and so I think now there's more of an awareness and an openness and a willingness to kind of take those stories and those experiences and really use them to help the system.
Okay. And you have been there to see a lot of change. And jumping back to something that you had touched on, Janet, is in terms of your participating in this and becoming kind of a parent family advocate. You talked a little bit how it has changed you. And so also from Vanessa and Jen, what has this experience done to you as far as being a parent, but also as an individual to take this role?
I've definitely gotten more bold, though I have to trace some of that change back to parenting my daughter in general. I've had to advocate for her, and I've grown in confidence. And the more I share our story and use it to do good, the more confident I grow. It also has helped a lot. Going through constant crises really drags you down, and I've been through some really deep, dark times. Being able to use those experiences to do something good for other families does a lot to lift the weight of it off of myself.
Yeah, I agree. I completely echo that. Being in a situation where I'm able to use our story to not only advocate for my children, but to advocate and change the system for others around me and for the people that are coming behind me, completely changes my perspective. And it definitely, there is a lightness in it. All of a sudden the load feels a little lighter because it just broadens that perspective. And it's so easy in the midst of crisis and those times when it feels like no one understands, and it's so easy to just kind of narrow our focus and just try to survive. And I think that participating in a project like this and really using my voice, I'm not able to stay in that place. I'm not able to stay in that spot for very long of feeling just really down and frustrated and like I'm fighting the system. I very quickly make that shift to, this isn't just about us. There are things that we can do, and by pushing through, it's going to impact others that are facing the same struggles.
I think that brings up a good point, though, is that the longer that those of us who are already in the system are in there, the less effective, to a degree, our own stories become, because they've heard our stories. Right. And they think, oh, well, we've addressed their story. So hearing the stories of other families and being able to bring those stories back to the system. So even if, for example, if you're out there listening today and you have a story, but you're not ready to get involved, or your family's in crisis, it's not easy to give more of yourself to something else when your family's in the middle of a crisis. But know that your story is incredibly impactful in the system if you allow us to share some or all of the aspects of your story, even in a confidential way within the system, to say, look, right, okay, so you've addressed my story. I mean, my crisis is over, right? I don't have anything more that I am going to be bringing relevant to the conversation that's current and ongoing to the table. But if I can share your story and I can say, but this is still happening in the system and this is what it's looking like for these other families out there, that is hugely impactful. And that's the kind of thing that not only keeps us relevant and effective in the system, but also gives you relevance and effectiveness in the system, regardless of how you decide to participate, whether it's just sharing your story with us, whether it's just being emboldened to take the next step, for your own child, and not necessarily joining the Yes Project, or, jumping in with both feet and saying, hey, I want to get on those committees, or I want to do, tell me how to get involved. All of those things are very valid ways of being incredibly effective. And honestly, I think for all of us, if we know that you feel like you're a little less alone and you're a little less the only parent out there going through this, that's a huge win for all of us.
So, Gina, how does someone share their story? So if we have parents out there like, oh, I've got a story that I bet hasn't hit that table before. What does someone do? Because you led right into a perfect question of how do they connect with the parent network? How do they, who do they tell their story to? How do they keep confidentiality because they don't want to have their name on a story? What does that look like?
So there's a lot of different ways to get involved, and I can share a couple, I think, on down the line we can. We've started, each of the parents from the parent network, we now have a regional contact in each of the areas. And do you know the email address for that, Carol? We'll have to look that one up.
We'll have to look that one
We'll
up.
get that one back
Right.
to you before the end. But we each have a regional contact email, so you can reach out to one of the parents who's existing on the parent network.
And I would say at this point in time, I would contact just the Federation.
And right.
And then what we can do is then shoot you out to the parent that is in your region and make that connection. So that would be cdixon, cdixon, at idahofederationorg, and I will make sure that you get sent to the right person.
So we do have, and we will be getting those out there. That's something, the email addresses are newly developed for our regional contacts, which is why we don't have that information right at this moment. There's also a closed Facebook page that's Idaho Parent Network. So if you go to Facebook and you look up Idaho Parent Network, you can send a request to join the Idaho Parent Network, and that goes to you, right, Jen?
Yes.
And so there's a closed group that will enable you to put out questions, bring information back to the group, reach out to families for support or help, or to share your story there. So those are a couple of different ways that you can start to reach out to us to get involved.
There's also a survey that you can take that asks questions about your experiences, and there are open questions that you can put in as much or little information as you choose. And the link to get to that is idahoya.org/parentvoice.
And what's being done with that information? So there's a survey, parents are responding. Where's that information?
So the survey responses are going back, not with any names or personal information, but just as groups, as statistics to the project. And all of the staff we've worked with over at the state are really excited every time we bring back new survey results, because they want to know that they can't get a hold of every parent in the state to find out what's actually working and what's not. But the survey has been a useful tool to let them know what are actually the concerns out there.
Also, you can, as you have listened to this information and learn more about the system today, reach out to people in your community that you know are struggling. Talk to your children's physicians and let them know that that this parent group exists and that they can refer parents to the group, so that we are starting to get voices that are, and we're reaching out to families who right now feel very much alone and very much like they're going through this on their own, and help them become aware of the changes that are coming.
Okay. So does anything at this point in time exist kind of in terms of like smaller groups on a regional level, or like what is the vision of the parent network? Since you've only existed for a year, you've been like super involved in project work that has been really consuming. But in terms of as the network is growing, do you all have a vision for what you want it to look like or eventually be able to do in the community?
So part of the vision when starting the network was there was a recognition that different regions in the state, different communities, not only have different needs, but have different resources as well. So in starting the network, we really worked to recognize those differences and take into account just the uniqueness of the regions. So the hope is that as the network grows, it will be a very organic type of growth, that there will be, we have structure within kind of a leadership framework that recognizes each region, kind of a core group of parents from each region. But then that network outside of that has the potential to connect any parent who wants to be connected. So, there's opportunity for regional groups within the network. There's an opportunity for communities to kind of have a group of parents to connect that are then that are associated with the network to kind of be that information sharing component, and provide training to the parents, and then the parents provide information back that could inform the system as it's changing. But the hope is that that's going to be a very organic process, that it's going to meet the needs of the community, kind of use the current resources that they have, but will be supported still by the network in kind of still providing that communication and that kind of overall structure. Mm-hmm.
So for parents that are listening, if they're like, yeah, I'd love to see something like that at my community, how do they let you know?
So I think those regional email addresses are probably the best way to start. So just contacting you and getting in contact with their regional contact. And then that person from the parent network can kind of help them talk through that, can go through some of the training information, about the YES project, and can kind of help get that started on a regional basis. But I think there's a lot of opportunity to just kind of meet those needs on a smaller scale, because every community kind of has their own unique flavor.
Okay. So it sounds like there's a pretty good spectrum in terms of how parents can involve. If they're more just needing information, needing support, they can participate on that level. If they're ready to engage, they can do it on a local level, or they can jump into projects on a larger state level. So will the project start rolling things out more locally, where parents are going to start seeing things in their community, and will the network be involved in that aspect as things come closer to home?
So some of the changes that are coming out, starting in January, we're starting with a new tool called the CANS. It's Child Adolescent Needs and Strengths. It's an assessment tool that is quite different from any of the assessments that I ever went through with my child. It basically is it's a conversation, and we're going to need to train parents on how to have this conversation, because for the first time probably ever, your voice is a critical piece of this puzzle. The CANS really looks at the entire family unit and all the whole, beyond even the family, right? How the child is functioning in school, in the community, in the family, how the family unit is functioning. And the reason that this is so unique and so different is that by getting the entire picture of what's going on, the team that's coming together, of which you will be a critical member, your child will be a critical member, the physician's going to be a critical member, and then other people within your community that are provide critical support. So maybe it's an uncle, maybe it's a pastor, maybe it's a school person, all of these people are going to be coming together and taking the information that the CANS helps gather about your entire family and about its functionality to to look, instead of just looking at symptoms, which is frequently the way assessments for, at least for my son, were done before. It's like, okay, so he has this symptom and this symptom and this behavior or whatever. It allows them to get a good picture of actual root causes, right? So what is happening underneath that's causing these other symptoms? And then to come together really as a unit and say, okay, these are the best practices. This is where we're going to go. Is this what you're comfortable with? Is this, how do you feel like we can best support you, your entire family, not just the child, but your family, to make a difference? That CANS is going to start being used on a limited basis in January. It'll be through an independent assessor. We'll do a shortened version of a CANS and a diagnostic assessment if your child doesn't have a diagnosis already. And that mostly will be done, or maybe entirely at this point. It keeps the target keeps changing on this one, almost on a minute-by-minute basis. But right now, the plan is that will start being used for families who do not currently have Medicaid, so they don't qualify for Medicaid, but are looking at a child with a mental health diagnosis, and they either are looking at maybe qualifying for Medicaid because there will be an increase in the percentage of the federal poverty level. So right now, qualifying for Medicaid without a developmental diagnosis, so not the Katie Beckett waiver, is up to 185% of the federal poverty level. Starting January 1, that target's going to move up to 300%. And it's not 300% of your gross income. There are deductions taken to that. So when you look at those numbers, if you Google search 300% of federal poverty level, and you see what that is for, your family of 4, your family of 6, whatever that is, don't take that number to be, it's, $67,528 and we make $68,000 so we don't qualify, right? Or we make $75,000 so we don't qualify. There are adjustments to that, and it's worth it to potentially go in and have this independent assessment done. It is a shortened version of this CANS, and your voice will be really, really important in that. And also the trust that you have with the independent assessor is going to be vital, because none of us want to share the worst of what our children have done, or the worst of our parenting in those crisis moments with somebody who we feel like is going to use that information against us. That is not the goal of the system. The goal of the system is to have trust between those who are going to be working with us to develop care plans for our children. So that is one of the big changes that will be coming starting in January on a very limited basis. And then the other change that happens in January is that there will be voucher respite. That's the new one, right? Or is that the one that exists now?
So we have voucher respite
voucher
now,
respite.
but it will become a Medicaid
there'll be
service.
Medicaid, right? Medicaid respite will be provided also. So if you go through the independent assessment starting in January, and qualify, and then you go through the approval process for Medicaid if you don't already have Medicaid, one of the additional services that will become available is respite through Medicaid. And that really will take place currently from January to July. And then in July, they're hoping to start rolling that out to the entire provider community, where the independent assessor will still be required to qualify for respite, and for those people who are over 185% federal poverty level. But then they're hoping to roll the CANS out as the assessment tool statewide for all people starting in July.
So Janet, that's a ton of information.
I've never done that before.
And we understand what you're talking about because we have been in the project.
Right.
For parents hearing this for the first time, it's like, whoa, I can't absorb. I can pull things out of that. So how does the parent network help parents who all of a sudden are going to be hearing all this new information and they're not sure they can grasp it all?
Right.
Is the network set up at all anyways in terms of even if it's directing them somewhere, or having information like on the web page that kind of breaks things down into chunks? How do you see the parent network helping? Because I think you had said earlier, as parents really need to understand and kind of be trained as they're going into some of these new processes. If you go in blindly and everything has shifted and you show up at a table unprepared because you are coming to do what you have always done and they're looking at you to do something completely different.
Right.
Is the network ready to help parents with that?
So there is yes, and no. So we'll get to that. One of the work groups that is working on the YES project is the Workforce Development Work Group, and I don't know about most of you, but from myself, when I heard workforce development, my immediate thought was the professionals that are surrounding my child. But the Workforce Development Group, because of the importance of parent voice within this new system of care, took a broad view of workforce. And they actually include parents in that definition of workforce. So the concept of that means that while they're developing training for professionals related to the new system of care, they're also looking at developing trainings for parents, so that parents can interact within this new system, because it's a huge shift within those dynamics. So the parent network will have a role in kind of giving information about what those trainings might need to look like, helping the agencies that are developing the trainings that are on the Workforce Development Group really figure out what it is that parents need to know in order to come into those meetings and be able to provide voice for their child and their family, in order to advocate for the services, so that parents can really come in knowledgeable and ready to participate. So it will not be, and Jan and I are both on the Workforce Development Group, and that's definitely one group that if parents are interested in participating, that's a great place to kind of begin to learn more about the project. But so the parent network won't be necessarily providing those trainings, but really providing input into those trainings and kind of supporting that. I think the other thing that the parent network is going to be really critical in as these services are rolling out, no one expects this to go smoothly. There are going to be bumps in the road, and there are likely to be some big bumps. And so the parent network has really set themselves up as a place where if parents are experiencing challenges, if there are situations happening where you're like, I don't think this is really what this new system of care is supposed to look like. It feels like, it feels kind of like the way we used to do things. I thought that this was going to be different. If you have questions, if it just feels like you're not understanding, those are going to be the kind of, that's the kind of information that's going to be really helpful for the parent network, because the parent network can then communicate that information back to the state and to the work groups that are doing the projects. They've got a lot of moving parts too. They're dealing with a lot of regions. They're dealing with a lot of communities, and a lot of people within that. They have a lot of systems, and so to be able to pick out the ones that maybe just need a little bit more support or a little more education to support parents in the way that they need to be supported, I think is going to be really critical. So the parent network is kind of in a position to do that. So that's another reason why it is good to kind of have those contacts, those regional contacts, so that if you do hit a bump in the road as the CANS is rolling out, as respite's rolling out with the independent assessor, different things like that, so that you kind of have someone that you can contact. Because the thing that I want parents to know probably more than anything is as all of this is happening, don't experience something and think, oh, I guess that's just the way it is now. Right. If it doesn't feel right, if you have a question, if you want it to be different, reach out and ask that question. It may be that it can't change. There is a lot of bureaucracy, and there are some things that we all wish we could change that, as we're learning federal law and different things like that, it's just kind of, we have to work with it. But I don't want parents to hit a wall or be told no or have a negative experience and just have to sit with that, because we don't have to do that. We have a network, we have a connection to be able to kind of reach out and get support. So,
and as you're going through this too, if you have a good experience, we also want to hear that, because if something did work right, that's really important feedback for us to bring back to the system. Hey, this parent experienced this, and they were really reticent, or they, they noticed a significant difference on the outcome or on the experience for them was very different than how it has been That's important information too. But
Because then we can replicate those experiences.
right. And we
across.
can also identify when, hey, Region 7's really got it going on, but Region 3's got a huge problem, right? So we know, because then we know it's a training thing, right? If we know it's working in one region and it's not working in another, we can start to look at what's different in that region. Why isn't it working there? Because we know we've had success over here. And that's really important. But I also want to just reiterate what Jen had said there. If you have an experience that is not comfortable for you, that you don't like, that you didn't trust the person you were talking with, or I don't care what it is. If it's something that doesn't feel right to you, trust your gut. That's the hardest thing. It was the hardest thing for me to do. I'm assuming at this point it's probably one of the hardest things for other parents to do too. Trust your gut. If you're feeling like something's just not right, call up somebody from the Parent Network, reach out to Carol and get in touch with one of us and say, hey, this was my experience. And we're going to look at that with no judgment and be able to say, yep, that's about how it goes, or whoa, let's make some changes here. Like that's something that they need to know about. And we can't do that if we don't hear from you.
Okay, so it's a pretty powerful little group of parents that are making a big impact statewide. And you do say there is like representation across all of the state, because the state is very different in terms of our rural areas compared to our larger city areas. And parent voice from all of those areas is being brought to the table. So that's pretty awesome. So how many surprises? I'm just curious if like anything that you've kind of gone, oh my gosh, it has shocked you or surprised you about your involvement in the last year?
I think probably for me, the biggest surprise for me was the first time that I walked into, and you're going to have to tell me the name of the committee because all I know is the IWG, and I always forget implementation. I always want to call it interagency, and then I go the other direction. So the implementation work group, which is the work group that has the heads of all the different divisions. And we've never really said, so the lawsuit incorporates not only Medicaid and the Department of Behavioral Health, but also Juvenile Justice and the State Department of Education. So we have a lot of highly important people at this table because it's the heads of all those people and all their attorneys and the plaintiff attorneys that are at this meeting. So I walked into this meeting for the first time, and Vanessa was in the meeting for the first time, and I think one of the first things they did was they had this feedback from parents, and it's one of the first things on the agenda. So literally everybody does the introduction. It's like, okay, parents, what do you have to tell us? And we're like, well, Vanessa got up and shared a very important story from her family, and I got up and shared a very important story from my family. And immediately following that, we had a break, and Matt Wimmer from Medicaid came up to me afterwards and said, we need to talk. We need to sit down and look at why these services may need to come out in a different order than what they were planning on putting them out in. And it was because of the stories that Vanessa and I shared that they were suddenly going to look at maybe implementing the services in a different way, or a different order. And for me, that was like an oh my gosh moment. Like what I have to share and what in my experience that I bring to the table, my unique perspective, matters to these people. Like it's not just a bunch of attorneys sitting around trying to figure out how not to do what the plaintiff attorneys are telling them to do. It really is people sitting around saying, we want the experience for these kids and these families to be different than it is. And if their story is the way it is, then and what we're doing isn't going to change that, then we need to make a difference, right? We need to change the way we're doing things so that we can accommodate that. And for me, I think that was one of the most impactful moments, just knowing that my voice mattered.
Any other aha or surprises for?
Well, I would echo the same thing. Janet gave just one example, but there have been lots of other situations where I've had similar experiences that I've made a comment and things have changed based on my information that I've shared. During the development of the CANs for Idaho, the CANs is a tool that's used in dozens, maybe even more than that, of areas. Each area chooses the questions from an item bank that fit with their needs and their population. As we were choosing the questions that would go on the Idaho cans, I felt like there was something missing, that none of the available questions that had been used in any other cans had covered. And so I brought that up with Dr. John Lyons, the creator of the whole can system. And he said, that's a great point. Let's create a question. And so there's a question on the Idaho cans that hasn't been anywhere else yet, but it's available now for everyone to use because I brought up a concern at the table. They want to hear from us. These people want to do well, and they need to know what it's really like living with a child with a severe emotional disturbance, and what it's really like being a parent dealing with the police officers and the hospital staff and the school staff and all of the people who think that because they are professionals, they know what our kid needs. But we're the parents. We know what our kids need way better than anybody else can. And having the bureaucrats in the system, I've spent years fighting against the system to get my family what we need. But to realize that the people at the top of the system really want to know and really want to change things has been very rewarding and surprising to me. It gets less surprising as I get more involved.
Yeah. I think for me, there were a couple of things. I think the first is that as I gained more knowledge about the system, it changed the way that I advocated for my child. And that was a surprise to me. I think too, and these two tie together. I think the other thing that surprised me was that even in the midst of bureaucracy, even in the midst of federal and state laws that can't be changed or would be very difficult to change, there are still opportunities to create a system that embodies parent voice and youth voice that is focused on the needs of the entire family, that really elevates the strengths of a child and works within those strengths to meet the needs. That even in the midst of those bureaucratic limitations, that a system can still be developed that feels different from typical bureaucracy. It takes creativity, and it takes it takes parents being willing to share those hard stories. It takes professionals being willing to kind of think outside the box and be open to those stories, and not just immediately put up a wall that, well, this is the law, this is what we have to do, so that's just the way it has to feel. We can still meet those obligations that are required, while at the same time creating a system that really empowers parents and youth. And I think that's been a surprise for me. It definitely was the hope when we were, originally creating some of this, but to see some of those pieces kind of start to lay out in the midst of the project has been exciting.
So part of what I hear you saying is it's a whole philosophical shift.
Absolutely.
So, you can't regulate through either federal or state code how philosophically you approach families and children and the strength-based approach, which is new.
Right.
And I think that's part of what parents are really going to feel, provided it does go from top all the way to, and it sounds like what we have seen over the past year is at the top, that they get it. They've made kind of that philosophical shift. But then it has to be able to trickle down through training out to all areas of the state, so that those people who are working directly with the families have kind of have made that shift.
And I think if there's one thing that I want parents to take away today as you're starting to go into this new system, before we've had a system where the physician was the expert in the room, right? It's like, I'm the expert on RADs and I know how to deal with kids with RADs. The paradigm shift here is you are the expert on what's going on in your family. You know all the ins and outs and as many of the whys and wherefores as a parent can know. The child is an expert on what's going on in their body and in their head, right? They're the only ones that really knows how it feels to be them and what triggers what. And the provider at the table is maybe the expert on RADs or whatever, but they're not the expert on your child's RADs. They're just the expert on having the knowledge of how typically children respond with RADs, right? So it's going to take everyone being at the table and all of that information, and everyone willing to listen to each other with the expert voice that they bring to the table. So when you're starting in this new system, go forth with the power and the knowledge that you are the expert on what's going on in your family, and any decision that's made that doesn't incorporate your point of view and your feelings and what you feel like is best for your family and what your child feels like is best for them is a dysfunction of the system. It's the system failing again, and we're not going to go forward with a fail-first approach. So those are the times that we really need you to speak up. Mm-hmm. If you feel like your voice is getting overridden at the table, that's not a good thing. That's a system failure, and that's not what we want to have go forward here. So, if you can't accomplish what you need to accomplish in that setting, that's a perfect time to reach out to the Parent Network for help and support in trying to make a change that's going to be for the benefit of your child and your family.
So, Janet, that leads us really well into kind of one of our last questions for the last 5 minutes or so we have. So from the experience that you have had and what you have learned by getting involved and learning to advocate and representing your story and also your family's story, what 3 tips would you give parents who may be choosing to get involved on local or state level, or just for their family in terms of learning to advocate and learning to speak up? And you hit on it a little bit already, but other ideas, if you were just okay, I'm going to give you a little gift and here it is.
One that I would definitely say is it's okay as you consider the opportunities that you may have to kind of commit to the project or commit to any sort of parent advocacy work or connection with the Parent Network. It's okay to commit for a season. That is something that I think we have, as parents that have been involved in the project, work really hard to educate the professionals on, is that the commitment of parents is not going to look the same as the commitment of professionals. We have kids that go in and out of crisis. We have school year schedules and summer schedules and sports schedules, and there are some seasons of life that are just harder than others. So recognize that that's something that the Parent Network understands. That's something that we're working to educate professionals on. So if it's feels like a calm time and you're okay, I think I've got a little bit of time to jump in and do something, then do it. But don't feel bad when that season ends and you need to pull away for a little bit and then be ready to come back. I think that's something that I personally experienced when I needed to kind of step away from some of my responsibilities for a few months. And then as life shifted a little bit, I was able to take on a little bit more. And that's very empowering, I think. And that's something I want parents to know. It can feel pretty daunting to commit to yet one more thing. But the rewards, hopefully you've heard that from us, the rewards of participating in advocacy, even if it's just a small part, even if it's just finding, one other family that you can help support and walk through this journey, the rewards for that are just are immense. So I would definitely recommend that you kind of take that step. Another one that I would say is be willing to ask questions. Ask questions of the professionals that you're working with, whether it's in your treatment planning process or in work groups or meetings, ask questions. Ask questions of the professionals, ask questions of other parents. We've talked about that in the parent network, and be willing to ask questions of yourself. If you're feeling uncomfortable in a situation, or you're participating in a meeting, and sometimes there can just be something that somebody says, that a professional says, that to a parent really feels off. It may feel stigmatizing. It may feel uncaring. I think it's judgmental. I think it's really important to ask that question, what's going on here? Because as we get to the bottom of kind of what's creating those uncomfortable feelings, we begin to create opportunities for education and opportunities for change. And, I've discovered that the professionals that we're working with have the best intentions. We've talked about that. And they really
So what's the question you would ask? You set up a great scenario of being in a meeting and hearing something judgmental or something that was stigmatizing. How do you frame a question?
So, so there are times in those meetings where I won't ask the question out loud, right? Because maybe I don't feel comfortable, and I'm like, "Ooh, I'm just going to sit back and just let that one go." There are other times where I'm feeling a little bit braver, and I may ask, the whole, tell me more about that. I use that one with my kids all the time. I think that that's an appropriate question to ask. Mm-hmm. Like, just that curiosity piece. What's really going on? Trying to figure out if that statement came because of a regulation, because of some bureaucracy, or if there was an experience that may have happened that kind of created that thinking, within that person. We are not the only ones. Parents aren't the only ones that are coming to the table with experiences. Every professional that's sitting around the table is coming to the table with their own experiences. And we don't always know what those are. So to be willing to just kind of ask for more information if something seems hurtful or judgmental, I think is really helpful. And then, being willing to say, okay, I understand what you're saying, but this is how I perceive that. You have the opportunity to do that. I don't do it every time. Sometimes I just let things slide because I know maybe I'm not in a positive emotional state to be able to handle it. But I think that it's a good thing to do. And even if you don't ask it out loud, don't take the time to ask it and kind of process it yourself, because these are emotional. A lot of this triggers some interesting emotions and feelings and experiences for those of us that have kind of lived this. So those are good.
There have been several times that I have waited until after a meeting or a conference call is over and debriefed with somebody to get myself into a calm and good place, and then gone back to ask the question to either kindly and diplomatically let the person know that what they said was offensive, or to find out where it was really coming from. So it is okay to step back and make sure that you're in a good place before you address that. I just, please don't just not address it, because these things need to be brought up, and it's not going to change if we don't speak up. Yeah. So I guess from the 3 tips advice question, I would say speak up. That's my one piece of advice. Don't be afraid to speak up, whether you're at an IEP meeting or a doctor's appointment for your own kid. Don't be afraid to speak up, whether you're sharing your story with the parent network, or if you decide to get more involved in your regional children's mental health subcommittee or in the YES project. Don't be afraid to speak up. People need to hear your story.
And I think probably from what you all have said, there's 2 tips that I would have. One of the things that I learned very late, too late for my own family, was when someone was recommending a certain service or denying a certain service, don't be afraid to ask why. Why are you recommending that service? How is that service uniquely qualified to meet my child's needs? Or why aren't we considering X, Y, and Z? And be willing to push until you get to the kind of the root of why that service is either the best service for your child and you agree with that, or maybe they're denying a service that you really feel like is the most appropriate service. So be willing to ask kind of those questions to find out more information, and get them to the point where at some point sometimes they'll say, well, I'm not really sure why, or they'll say, well, it just is that way. Well, okay, so that's not really a valid answer, right? The other thing that I think is really important when we're all going through this process is to have grace. First of all, have grace for yourself. What you're doing, there is no manual for. There is nobody out there that has the exact same experience you do, but those of us who have similar experiences will all tell you, we're going so far above and beyond that even in our failures, of which there are many, and our embarrassment and our guilt over failing our kids and not knowing the right thing to do, and that helplessness feeling that we get from not being able to crack the egg, from not being able to, we walk on eggshells. I think that's probably a common thing for all of us, right? We walk on eggshells day in and day out. It changes you. Crisis changes you. Living in survival mode changes you. Your emotional level is going to be way up here, and that's normal. Right? I mean, when you were talking about the biggest thing for me, I forgot about that. That is absolutely the biggest thing for me. When I came to the Parent Network 6 years after my son passed away, and I listened to the other family stories, the passion and the emotional energy that is behind those stories when they're telling me their stories, and the crisis level is still up here for them, for the first time I realized that's normal. What I went through when I was dealing with a child with Angelman syndrome and a child with severe emotional disturbance who was suicidal, my reaction to that was normal for those circumstances. But I was comparing myself to other families who didn't have those things. So have a ton of grace for yourself. Give yourself, as much room for just being human as you possibly can. But also extend that grace when you can to the people that are working with your child, because this is all new for them too. They've not had to do it this way before, and they're going to make mistakes. And if we can express grace for ourselves and model that grace for them and have grace for them as well, there's a lot of hope for movement and forward progress in the system.
Okay, great tips. So just to recap, in terms of if you want to contact the Parent Network, you can do it through reaching me at my email, cdixon, which is Dixon at idahofederationorg. And also the Facebook page, if they want to find that, they search for
Idaho Parent Network. And it's a Facebook group. It's a closed group. And there are instructions for joining. You will click the join button, and then it has my Facebook profile to message with just some information about where you live and just a little bit about how you found us. The intention for that is so that we can kind of create a safe place, so that you know that when you share something on that closed group, that the parents in that group are also from Idaho, and that they are also parents that have a child that's struggling with an emotional or a behavioral health challenge, so that it just creates kind of that safe environment.
You'll know you found the right page because it has the logo that we have on our shirt. It has that logo on it, so that will help you be a visual cue for knowing you found the right place.
Okay, so not being like super social media savvy, is that taking them to the open Facebook page and they then click on getting to the closed page, or is that taking...
If they search Idaho Parent Network, it should come up with that Facebook group. It may also come up with the page, because we do have a public page for the Parent Network, but if you're looking for the closed group to have discussions, you'll just look for the group. It should pop up.
So how do they get to the public
that
page? The
public page, you can search Idaho Parent Network. I think it's the same thing, or it may just be Parent Network, but it has the logo, and you can just like that page and kind of follow that. That's the more open. Don't share your deep stories on that one. That one's the public page. But it's just a way for anyone, if you're a professional listening and you want to kind of stay up to speed with the Parent Network, that's the page that you would go and like. We're trying to keep the other one just connected just for parents.
And is the open page, is the Parent Network putting information out there just in terms of what's happening with the project and tips about, what's coming up? And
So that's the hope. We just had a conference a few weeks ago, and we had some new parents come into the network, and there were some that were interested in working on that social media piece. So they're currently working on a social media plan to kind of get that information up and going. So hopefully in the next week or so, it'll be a little more active.
So the recognition that it is a group that is evolving.
Yes,
They've only
absolutely.
existed for a year. Parent-driven, volunteers, giving extra time on top of, already being involved pretty heavily in the project. So as Janet says, give grace if, great ideas that are there just take a while to get into place. And there's definitely a need for more parents to participate. If you want to do social media, when you contact what your interests are and where your skills are, definitely the possibility that they could plug you into a place that, they have a vision for but don't have the steps yet. So, ladies, again, thank you for multiple reasons, for being here today, but also your participation in creating a system that really is based on understanding what the needs of the families are, because without that voice, as you've said, we've got great people working on it, but how can you do that when you haven't experienced it? So thank you for being bold and brave and willing to share your stories, and then representing the parents across the state. So with that, hopefully there's some information that you have gained in not just the Parent Network, but also what's going on with the YES Project, the opportunities to get involved on a local or state basis, or even just more so with your individual family and the needs of your child. So know that there is a group here that's backing you up and supporting you. Feel free to contact as you need. And with that, thank you for joining us. Next month, we are bringing in another group of parents. These parents are the ones who are certified as the certified parent support partners to talk about what the work they are doing. And that is a Medicaid billable service that's relatively new to Idaho, where you have parents with lived experience going into the communities to work with families who have a child with a mental health diagnosis, to support and provide education and navigating through systems and things like that. So they will be joining us next month to talk about what they do, but also talk about how other parents could potentially become certified parent support partners and get involved in that. So thank you very much. Have a good November. Happy Thanksgiving, and we'll see you guys again in a month.